today? Good, I'm glad to hear. You're here for a cranial nerve exam? Perfect. I just want to get some of my details down here real quick, okay, on my chart. Just gotta quickly find your appointment here. Bear with me for a moment here. Bear with me for a moment here. There we go. There we are. So I've got you here today, and just confirm your name for me, real quick for me. Okay. Perfect. And just quickly your date of birth. Just your date of birth. Okay. Perfect. Perfect. Okay. And we can get on with the rest of the tests here, okay? So this will just be your basic cranial nerve exam test today, okay? Just doing a yearly checkup. Perfect. It's always good to do those kinds of things, so good on you for that. And I think we're going to start with some sound tests, okay? So I'm going to be tapping on the top of a bottle cap, just on each side of your ear, okay? Just on each side of your ear. And then I would like you to tell me when that sound stops, okay? When that sound just completely stops, you let me know. Does that sound easy to you? Perfect, I'm glad. Let's get started with this. Okay. First, I'm going to start on just the one side here, okay? Perfect. And just let me know when that stops. Good. And just on the other side here now. Good. Okay. And just again on this side here, okay? Good, good. That one was a bit of a long one there. And just on this side once again, okay? Excellent. That one tried to trick you there a little bit. So everything, you seem to be able to tell when those sounds stopped immediately? Okay. So I don't think we have any issues with your hearing, so I think we'll get moving on just to the next one, and we're going to use that light stick. All right, we've got my handy dandy light pen here. Okay. And we're going to be doing a few tests just to see where your vision's at for your cranial nerves, okay? Great, great. Let's get started. We're first just going to have you, I'm just going to have you follow the light, okay? As it goes around, just follow it with your eyes, okay? Tell me if you have any issues whatsoever, okay? All right, let's get started. Just follow that light wherever it goes here. Good, good. You might hear a slight, almost like humming, to soothe you along with this light journey, along with this light test. So just allow it to wave over you with relaxation and follow the light. Good, good, good. Yes, very good. Follow that light. Yes, very good. Good, good. Follow that light's path. Follow that light. And relax to that humming sound, okay? Perfect, perfect. Excellent. Good. Keep following the light. Keep following it, okay? I'm just going to have a look the sides of your eyes while you follow the light here, okay? Good, good. Very good. Very good. Okay. And now we're going to have have my finger up as well. And I want you to focus on the top of my finger here and ignore the light, okay? This will allow me to see around your eyes and see if your eyes are responding properly while you are trying to focus on another object while light is passing by, okay? So I'm going to keep my finger in one spot, and I just want you to stay focused on it. Don't get distracted by the light here, okay? Don't get distracted. Keep your eyes and attention on the top of my finger. Good, good. That's looking perfect. Excellent, yes. Very good. Keep your focus on the top of that finger there, okay? Yes, excellent. That's exactly what we're looking for. Keep focused on that fingertip. Now the finger will begin to move slightly, so I'd like you to keep up with it and keep your eye just on the fingertip, okay? Here we go. Good, good. Excellent, yes. Yes, don't get distracted by the light. Don't get distracted by the light at all, okay? Don't get distracted. Don't get distracted. Good. Okay, perfect. Yeah. Excellent. Good, 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 good. Keep your eye on the tip of my finger here, okay? Perfect. Excellent. Now I would like you to switch up and focus just on the light, okay? Just on the light, and don't get distracted by the waving finger, even if it gets in your way. Do your best to stay focused on the light, okay? And here we go. Good. Don't let it distract you. Good. Allow that humming sound to soothe you over as you stay focused on the light. Good, good. Even during the challenging parts, good. I need you to stay focused on that light, because it looks like your eyes are doing very well for this cranial nerve test here. Good, good. Stay focused, yes. Excellent. Good, good. allow it to distract you from following that light. Good, yes. Yes, excellent. Good job. Good job. Very, very well done. Very, very well. All right, good. Everything looks great with there. We're just going to do one last little test to involve your eyes, okay? I'm going to hold up a number between 1 and 5 on my fingers here, okay? And I would just like you to repeat the numbers that you see, okay? So we're going to start right here. Good. Yes. Very good, yes. Good, yes. Good. Good, good, good. Yes, very good. Excellent. Okay. Yep, just let that waves, the wave sound just flood over you as you tell me how many numbers I am holding up on my fingers. Good, good. Very good. Very good. Everything is looking fantastic. With your eyesight, you did wonderful on the light test and the following of the finger, as well as how many fingers am I holding up. So we are going to get moving on to the next one, which will be the scent. I'm going to have you smell some certain cards, and then you're going to tell me which scents they are, okay? So I've got three different scents here, okay? We've got 5 different scents here. My mistake. We've got 5 different scents here. And we're going to be using this brush right here. This brush right here, because they require a really good scratching first, okay? A really good scratching before they are able to be smelled. So we're going to be using this brush here, and we're going to be scratching each one. And I'd just like you to tell me what the scent is, or what you think the scent is, okay? And we'll get started with this first one here. Just give this a sniff for me. Very good. And what does that smell like to you? Yes, you are correct. But can you get the second one? Let's find out. And with our scratching here, Can you tell me what this one smells like? Oh, I hate to say it, but you were very close. So close. But I'm sure you'll be able to get the third one here, okay? So let's again begin with our brushing here with our very nice brush. All right, let's get this scratched. What does this smell like? Yeah, absolutely. Take a couple seconds with it. Yes, you got that one right. Good job. Let's see how you do on the fourth one. Okay? We are going to get you at least 4 out of 5 on this. I can feel it. Let's begin. Yes, that is correct. We've almost got you that 4 out of 5. We are down to the very last one, okay? The very last sniff and scratch here, okay? We are going to use our brush, and we are going to get you that 4 out of 5. Okay, let's get started on the last one. Give this last one a sniff here. Absolutely, take your time. And what's that last scent? Yes, you got that. You got that correct. We've got you 4 out of 5 for the scent. And I'll tell you, that is very fantastic. Great job. We are going to get moving on to the second last test we have for you today for your cranial nerve exam, okay? Excellent. Let's get started. Okay, so for this one, we're going to be examining the nerves on your face, okay? As well as I'm just going to be poking you on the shoulder, the neck as well, and just a bit on the chest, just to make sure that you are having and feeling those sensations of the pokes, okay? Yes, just like that, just like so. Are you ready? Perfect. Let's get started. Just tell me if you feel these. Okay, good, good. Yes, very, very, very good. Very good. Good. Okay. Good. And you're feeling that, those poking sensations? Okay, good. I'm just going to go just on each of the sides of the cheeks here now, okay? Perfect. And now just on your chin here. You feel those? Okay, good. just down to your neckline here. You feel that okay? Okay, good. Very, very good. Just on the other side here now. Good. And now just on your chest and shoulders. You do feel those? Okay, good. Good, good. You feel all these little pokes here? Good, good. Good, very good. So everything seems to be great with those nerves as well. You can feel all those little pokes that I have done. Okay, perfect. So that will leave us with just the very last test here. And this one will be testing your taste buds, okay? Your sense of taste. So let's get started with that. So I have 5 of these. Okay, 5 of these testers, and each one I'm just going to be spraying on your tongue like so. Okay? Yes, they are all pleasant flavors. Perfect, okay. And they all do need a good shake just to get the flavors going. And so that every spray will have that flavor in it, okay? Perfect. I'm glad to hear. That little water tornado in there, just to get the flavors exactly where they need to be. And if you'll just stick your tongue out for me, this is the first flavor you'll be tasting. Perfect. And can you tell me what that tastes like? Yes, very good, very good. That is correct. So we'll be moving on to the next one, okay? And keep in mind, a lot of the flavors are kind of in the same wheelhouse, okay? Just to give you a little hint. Okay. And here we have the next one. ready for the second one? Good, good. And I'll just have you stick out your tongue for me. Perfect. And can you tell me what that tastes like? Good, yes, that is correct. That is correct. You see what I mean by that hint I gave you? Yes, that's perfect. So let's move on to the next one. And we've got taste number 3 right here, okay? Make sure we give it that proper shake. I think this one is ready for tasting. Are you ready? Okay. I am glad to hear. And if I can just get you to stick out your tongue for me. Perfect. And can you tell me what that tastes like? Yes, that is correct. You've got that one correct. Well, you've gotten all of them correct. So you are 3 out of 5 at the moment. 3 out of 5. And that is perfect. I have no doubt in my mind you won't get the last 2. And let's get that last 4th flavor here. And we will give this 4th one a good shake. Perfect. I think this one is ready. And I'm just going to have you stick out your tongue. Good, good. And here we are. And can you tell me what that taste is? That is correct. You are currently 4 out of 5. You are on the way to getting perfect on the taste testing, okay? Almost perfect. So we will move on to the 5th and final flavor taste, okay? Okay. And this is the last one here. Last one just right here. We are going to give it, as you know, one final good shake. There we are. Are you ready for the final flavor tasting? Good. All right, and for the last time, I'll have you stick out your tongue. Good. And here we go. And tell me, what is that last flavor? Yes, that is correct. You have gotten all 5 flavors correct for the cranial nerve exam, and that is mighty impressive, as well as doing excellent on all the other tests. So I'm just going to put this last flavor over here and go over the results with you. And it's looking like all your results are perfect for each cranial nerve exam. For your yearly checkup, you have nothing to worry about at all. Absolutely. If you ever feel that there's anything that comes up that you're unsure of, please come see Dr. Relaxa, and I will make sure that everything is perfect for you, okay? Excellent. Now, is there anything else that you wanted to take care of while you were here today? Excellent. And I will be seeing you next time, okay? Perfect. Thank you so much. Have a great rest of your day or evening. Bye now. Hello. How are you feeling? Okay. Yeah, no problem at all. This is something new. I've been doing at-home visits for cranial nerve exams. Absolutely. Yep, I have all my bag of stuff here that we're going to need for the cranial nerve exam. So if you'll just give me a few seconds here, just unpacking, get everything ready just on the table. Side chart here at some point for sure. Yes, and we'll need to take some measurements as well here. So got this for the eye chart as well. These are for the gauze, just in case, you never know. And we've got my handy stethoscope here, as well as the light for our test as well. There we are. I feel like I'm in full gear now. Okay, so I think we'll just get started with taking a look at your breath, your breathing, and your heart, okay? Okay. So now I'm just going to come in here and just going to listen in on your heart as well as your breathing. So just take a couple of small deep breaths in for me, in and out, okay? Excellent. Perfect. I'm just going to check on the other side as well. And just take a couple deep breaths in and out for me. Perfect, everything sounds good there. Okay, and you made this appointment just because you're worried some of your cranial nerves were out of sorts? Yes, okay. That won't be a problem at all. We will get right down to it and we will get to the bottom of any issues that you may have, okay? Dr.Relaxa is here for you. Okay, so let's get started. I think you said the most thing that you were noticing the most was your taste. You feel like you've lost your taste. Okay. So what we'll do is I have a couple vials here. It has 5 compartments within the bottle. Can't really see them, but all 5 compartments are there. And they are different tastes within all of the different sections, okay? So we're going to make sure that you can taste all the different kinds of taste, okay? All those different kinds of tastes. Give it a little shake in this first section here. Just make sure it's on here. So it only releases just that one taste, okay? Okay, there we go. It is working here. And if you'll just stick out your tongue for me, and I will just give this a spray. Okay, and are you ready? Here we go. And can you tell me if you can taste that or not? You can, okay. And what exactly is it that you taste? Yes, that one is correct. Okay, so we're going to move on to the next one now. Just going to make sure that this second section is ready for the taste testing. Are you ready for the second one? You'll just stick out your tongue. Okay, perfect. Give it a good shake as well. And here we go. Now, can you tell me you taste that flavor? Excellent, okay. And can you tell me what that flavor is? Yes, that is correct. Okay, well, you are doing well so far, so let's move on to the next one, okay? Okay, we'll just make sure the third section is ready for the taste test here, okay? There we are. Okay, and if you're ready, if you can just stick out your tongue for the third test here. Good, okay, and here we go. Now, can you tell me, can you taste that? Good, good, yes. And what does it taste like exactly? That is correct, yes. Mango, banana, strawberry. That is correct. Good job. That is right. It seems like so far your taste buds are on perfect level, and the cranial nerves within your mouth seem to be working perfectly. We will move on to the fourth now. I'll move it over to this next section here, because these last two flavors are a little different than the first three, okay? They're going to be a little bit more specific. Okay, and if you're ready for the fourth one, if you'll just stick out your tongue for me. Perfect, and we are going to just give it a couple sprays here, and here we go. Very good. And can you tell me, can you taste that? You can kind of taste it. Okay, that's good. That's good. Can you taste it enough to tell me what it tastes like? Yes, that is correct. That is correct. Unami seaweed sapphire. That is correct. That is quite the taste. I'm surprised you were able to detect it at all. Your palate is quite remarkable, I must say. Now, this last one is a really tricky one. So let's see if we can stump you with this one. Because at this point, your cranial nerve is perfect. We're going to move on to the fifth and last section of the bottle here, okay? We're just going to tap it to activate it here. Good, good. Good, there we go. And this is the fifth and final test. Are you ready? Good, good. And just stick your tongue out for me. Okay, and here come the sprays. Yes, a lot is needed for this one. A lot of sprays because it's just such a subtle taste. And now for the question, can you taste this flavor? Okay, and the final question, can you tell me what that flavor is? It is remarkable that you are able to deter that. That is clam chowder of the South Side style, exactly how it is. I cannot believe you even got down to the style of it. This is incredible. But everything looks fantastic with that cranial nerve, so we'll just move along and see if your other ones are just as great, okay? Perfect. I think to start with the next one, I'm just going to measure your cranial nerves real quick, okay? We're going to measure them, and I'm going to tell you just how much they measure for, okay? So I'm going to just come in close here. Don't mind me while I measure your cranials. I'm just going to pop this on my shoulder, actually. I'm even just going to set that down behind me there. Dun, dun, dun. Okay. And we're just going to measure some of your cranial nerves here, okay? So we're just going to go 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 27, 28, 29, 44, 62. So that's 62 cranial nerves I'm seeing. 62 cranial nerves I'm detecting. So we're just going to measure out some more here, okay? So we're just going to keep counting. 1, 2, 3, 4, 2, 5, 6, 4, 9, 5, 2, 22, 23, 24, 25, 26. Okay, just back on this side here. 20, 29, 32, 67, 209. It looks like 207, 206, and 205, 204, 203, 202. Oh no, I'm counting the wrong way. Okay, let's go try this way. Try this way right here. We got 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13. Some number I'm not familiar with. 92, 85, 333. No, 3,033. No, 33,003. 62 and 75. And then we go and measure one of these cranial nerves over here just by themselves, and it's just this small little one here. 1, 2, 3, 4, 5, 6, 10. And then we're gonna just measure. We're gonna go like this, okay? I think we've gotten a lot of the measurements we're gonna need. So now we're just going to tackle the last few here. This is such a long one. Wow. Oh, I have to use the entire tape measure. Okay. Okay, so we've got... Here, I'll show you as we go. Well, you can't see it. Actually, there we go. Now you can see it. We got 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 22, 23, 24, 25, 26, 27, 40, 41, 42, 43, 44, 45, 46, 47, 48, 49, 82, 97, 54, 56, 52, 54, 59, and 60. That's the longest cranial nerve I've ever encountered in my entire professional existence here. Okay, and I just think there's just the one last little nerve here. Sorry, I forgot about this one. Okay, 1, 2, 4, 5, 6, 7, and 10. 2, 3, 4. And now just the little millimeter parts here. We're going to use this other side. Just 1, 2, 3, 4, 5, 6, 7, 8, 10, 16, 17, 18, 20, 21, 22, 23, 24, 25, 26, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30, 36, 72, 73, 75, 76. Then we go like this, and 62 in total. So that's perfect there. So we've gotten all those measurements there. So we can move on to the next test for the cranial nerve here. And I think the next one we'll start with... You know what? I think we're going to start with the smell tests, okay? So this vial, very much like the little water bottle there with the tastes in it, this little bottle contains 5 sections of different smells, okay? Different fragrances that it lets out as soon as I open the lid, okay? As soon as I open the lid, okay? And like the other ones, it needs to be preset each time. So we'll be doing some tapping as well as some bottle rolling here just to get it to move on to the next one, okay? There we go. And the first one is here. And I'm just going to do a little dropper over just like this to drop into the bottle so that the smell wafts over to you, okay? Just to make it a little bit more easier for you, okay? Perfect, okay. So here is the first one here. And if you'll just give this a smell real quick as the drops fall. And can you smell that? Good, okay. And are you able to tell me what that scent is? Not quite, no. Not quite. This one was just a hint of metallic, a hint of steel, okay? So we're looking for more metal in that family for smells, okay? But we can move on to the next one. But it is important that you did smell it, and your answer wasn't totally off basis. So I think we're still in the clear when it comes to your cranial nerve, okay? So we're just going to move on to the next one now, okay? Okay, we got the second one here all ready for you. So now, make sure we get the excess off so none drips on you. Okay, and the same. Ready? Just take a few sniffs as the drops drop. Okay. Good, excellent. And can you tell me what that smelled like? Good. Yes, that is correct with that one. Good. I'm glad to hear. That one was more banana-infused straw apple banana. Okay? Yeah, and I know what you're wondering. 2 different kinds of bananas. This world we live in. Okay, so we're going to move just on to the next one now, that third one, okay? And we're going to activate the bottle just to get it to give us that next scent that we need, okay? Perfect. Good. There we go. We've got the third scent ready to go here, and we're just going to have you sniff as the drops fall here, okay? Good. Very good. Okay. And now, are you able to smell? Good. And can you tell me what that smell is? No, not quite. I'm sorry. No, this one was deer musk. Yes, deer musk. Very faint scent. Like the taste tests, these ones will get a little bit more challenging, so don't feel bad. We've got 2 more to go, so I'm sure you'll be able to get the other ones. Let's make this the next one here, okay? And we're going to turn it over here. Good, there we go. Very nice. We've got these ready. The drops are ready. And if you'll just give it a smell as the drops fall here, okay? Just as the drops fall. Now, can you tell me if you are able to smell that smell? Okay, good. Yes, I'm glad you're able to smell it. And can you tell me what that flavor is? What that smell is? That is correct. Motorbike oil, motorcycle oil. You are correct. A lot of these are in those general ones, except for the fruity one, of course, because you always need at least one different in the batch, you know. And we are on the last smell here. So let's get moving on to that one. Okay, we are going to move it over to the next scent section in the bottle here. Okay, we have it moved over here, and if you'll just give it a quick sniff here. Good. And you're able to smell that smell, I imagine. Okay, good. And can you tell me what that smell is? Yes, it is. It's extra virgin olive oil. You got that right. That is our most challenging smell. There's almost no smell to it at all. Well, I'd say that your cranial nerves for your smelling is fantastic, because that one was the tricky one of all of them. So I think I'm satisfied with that one, with those two, to make a good assessment. And I think we're ready to move on to the next, okay? Okay, and I think we're just going to move on to hearing now, okay? And so what I'm going to do is take these scissors and just snip on each side, okay? And I'd like you to tell me exactly how many snips you hear, okay? You've got that? Good. And tell me how many you hear, okay? Good, okay, now just on this side. Okay, good, and just on this side again. Good, and just on this side once more. Good, okay. And just a couple more, just on this side. Listen very, very carefully, okay? Okay, good. And now, as I continue with these tests, I'm going to proceedingly snip away further and further, okay? And I'm going to expect that you're still able to tell me how many snips I do, okay? So you just tell me how many snips I'm doing here, okay? Okay? Good. So I'm going to start again on this side here, and I'm going to do that proceedingly, and let's begin. Good. Okay, on this side. Good. Okay. Now I'm going to continue with that on each side, but now I would like you to let me know when you can no longer hear it, okay? I'm going to get quieter with my snips, okay? Quieter as I go and proceed in either direction, okay? So I need you to tell me when you can no longer hear the snips anymore. No, don't worry about counting them, okay? Perfect, okay. Here we go. Okay, good. And just on this side. Okay, excellent. And we're just going to do it again, just on this side. Okay, good. Very good. Just go back to this side again. Good, very good. Okay, I'm glad you were able to hear that. Your hearing seems to be pretty well rounded, I must say, okay? So you're able to hear it how many times I'm able to, regardless of how fast I go, which is mighty impressive, as well as go as far as I can. And then as soon as I immediately stop, you're able to decipher that it has stopped, okay? So that is very, very, very good for that cranial nerve, I must say. Okay, so we're going to continue forth on to the next one, and that one will be we'll start with the eyes first, okay? So we're going to use a bit of the light pen here, okay? Okay, good. What? I'm sorry. What's that? The eye chart. Yes, we'll be doing that one after. Oh, you're not exactly, you're not great with that, your eyesight, you're saying? Okay, yeah, we can definitely skip the eye chart and save it for another appointment if you want to come in directly with that or another at-home visit. Okay, yes, we can definitely make a separate eye appointment. So we're just going to focus mostly with the light then today, okay? And we're just going to make sure that you're able to see the light come into your peripheral vision, as well as following the light too, okay? And as well as focusing on a fixed position while the light travels around you, okay? All right. So to start, I'm just going to have you follow the light. Just very, very follow it to the, just to follow it. It's going to start off slower, very slow. And I'm just going to be checking out around your eyes as they move in different directions, okay? So just keep focused on the light. Okay. Having a look at your eyes here. Okay, and I'm going to come in a little closer here. Okay. Okay, good. Your eyes are responding very, very well. They're responding very well. Yes, keep following. Good, good, good. And now I'd like you to tell me when the light goes out of your peripheral vision, okay? Good. 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 Yes. Good. Well done. Well done. Yep. Yep, just keep telling me. Excellent. Yes, fantastic. Okay. Okay. I'm just taking a look at your eyes while I do this. So just keep focused and tell me exactly when it leaves your peripheral vision here. Okay, perfect. This is looking really good, okay? Good, okay? And now I'm going to have you focus on my finger here, okay? Focus on the top of my finger. And I'm going to try and distract you with the light as much as I can. My finger will stay still for the most part. You'll see some movements just so I can see different parts of your eyes, okay? And then we will continue forward with the eye exam, okay? We'll move on to the next one. So just keep focused on this one right here. Okay, good. And I'm just going to try and distract you with the light here, but don't allow it to distract you or to take your eyes off that finger, okay? You're doing really well. Great job. Good, good. Yes, that's perfect, okay? Yes, excellent. Your eyes are looking very healthy and responding very well to all the tests that we've administered. Okay, good. Your eyes don't seem to be having issue following the finger as well while trying to be distracted by the light. Good, that's what I like to see with this test especially, because then I know you have full mobility, full range, and full ocular awareness with your eyes there, okay? Good, everything looks great there. And we will move on to the last section of the cranial nerve, which is just the touch sensations, okay? And today we'll be using just this instrument here, okay? And I'll just be poking different parts of your face here, okay? and just tell me which part I'm poking and that you can actually feel it, of course, okay? So we're just going to get started with that. Okay. And I'm just going to begin, and just close your eyes for me and just... Okay, and you can feel that on your forehead. Good. And what about here? You can feel that? Okay, good, good. And what about just on this side? You can feel that there too. Perfect. And what about just right here? You can feel that poking your eye right there? Okay, good. Good, that's good for your cranial nerve for sure. Okay, so I'm just going to go and tap right here. You can feel it on your forehead, okay? And how about here? You can feel that there too. Okay, what about right here? You can feel that there, just on your chin there. Okay, good, good. Okay, and what about right here? You can feel it. You can feel that tapping on your ear there. Okay, good. Okay, good. Okay, and what about just right here? You can feel me tapping on your other ear. Good, good. And what about just right here? Yes, your top right, top left of your forehead. Okay, perfect. Trick, I was tapping on both actually, so that is perfect. You seem to have an excellent handle on all your cranial nerves. So I think my visit here is done. So I guess I will just pack up my stuff and head on out. Yes, your analysis looks great. I will bring everything back, but everything looks wonderful with all your cranial nerves. Every section you seem to be doing perfectly in, okay? Excellent, fantastic. So I'm just going to pack up my little bag here, okay? And then I will be on my way and out of your hair. And we'll just put these just on the side here. And just the last item just right there. Okay. Well, I hope you feel a little better from how you were feeling. It seems like there's no issues with your cranial nerves. If you seem to have any other specific areas that are bugging you, please feel free to make an appointment. Again, with an at-home appointment or an in-the-office one with me, okay? Okay, great. I hope you have a wonderful time, and I will see you next time. Take care. Hello. How are you doing today? Good, I'm glad to hear. And you're here for... Okay. So you're here for a part of a cranial nerve exam. What seems to be the issue? Mm-hmm. 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 Okay. I understand. So you're having a bit of hard time and pain within your neck and shoulder areas. Okay, so you're having troubles moving as well? You can move it a little bit there. Okay. Yeah, we can definitely do some tests that will specifically deal with that. Yeah, so instead of doing a full cranial nerve exam, we can definitely focus on that specific issue today, okay? Perfect. First, I'm just going to get a few questions answered just to make sure that this is the right information for the right person, okay? Excellent. So I'm just going to start. Can I get your full name, please? Okay. 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 It's a very long name, but that's perfect. I think I got it all there. And if I can grab your date of birth as well as your personal number. Okay. Right. Perfect. And I already know the reason why you're here, so just give me a moment while I just fill that little section out for medical purposes, okay? Just for our files. Perfect. I got it all. Now, I'm going to do a few tests here just to see how bad it is from my perspective, okay? So I'm going to do a few of the tests that I would do for cranial nerve exams, okay? For the touching aspect, okay? So I'm going to be slightly moving your head back and forth, up and down, just seeing where your range of motion is, okay? And then from there, we will move on to the touch portion just to make sure that your nerves in your neck and your shoulders, as well as your lower head region, that you have the feeling in each spot, okay? So we're just going to test those out just to make sure that that's not the issue, because then we'll have to do a whole another range of tests if that is the case, okay? So we are going to move and start with just slight motions. Do you mind if I... Okay, perfect. And what I'm going to do is just slightly move you here, okay? And your neck seems to have very little mobility there. Okay, and then just on this side as well, we're going to do the same thing. Not much range of motion at all, I see, okay? Now we're just going to try and lift your head back a little. That's as far as you can go. Okay, and now we're just going to try and do the same and just go forward. Oh, it's even worse for that one, that pain level. That's a lot for you? Okay. So I think we will try this really quick because I already think I have an idea of how we can relieve this, but I'm just going to check out your nerve system in your touch sensories, okay? So I'm just going to poke you in just certain places, okay? Just on your forehead, on your cheeks, on your chin, on your neck, and just on the top of your shoulders here, okay? And I want you to tell me if you can feel me tapping that with this, okay? Okay, are you ready? We're going to start with, you can feel that on your forehead, okay, good. Good, and you can feel this. Good, and you can feel this on this other side. Okay, good, good. That's very good. So then what about just on the lower chin part here? You do feel that? Okay. Not as strong as up on the face. Okay, let's move down to just under the neckline there, okay? You can feel that, just barely. Interesting, okay. And we're just going to try on top of the shoulders as well, okay? We're just going to go and tap right here, just like that. And you can feel that. And just on this side as well. You can feel that on your shoulders. Just barely, like the neck, okay. So I think, from what I can see, you have a bit of a tense neck right now. It might be stress-induced. It might be physical ability-induced. Picking up something heavy, bending over and picking something up without the proper bended knee technique. These all are things that can lead up to that kind of things, okay? So I think what we can do for you today is I can give you a nice massage just up in the neck region, down and top of the shoulders here. Just make sure that every muscle is nice and loose, and then we can try those tests again to see the kind of mobility we get. Now, if it shows that there isn't much mobility, there is something else we can do, but we're not going to worry about that until we get to it, okay? It looks like it might just be tight muscles. Does that sound all good to you? Okay, perfect. Let's get started. Okay, so I'm just going to start on the upper neck here and just start giving a nice massage, okay? You tell me if the pressure's too much at all, okay? Perfect. just going to move on down to the shoulder area, okay? How's that feeling? Is that feeling much better? It is? Okay, good. You feel a little more motion in there? Good, okay. So I think what we'll do now is test out those 2 tests again, just to see where you're at. And then we'll go from there, okay? Perfect. So we'll just start with the movements of the head, okay? We're just going to try and go this way. Oh, you've got much more range in there now, okay? And we're just going to try just this way. Much more range of motion there. Perfect. And we're just going to go back now. Lots of motion. Good. And we're just going to go down now real quick. Good. So it looks like you have full range of motion in there. Good. Okay. And now we're just going to do this last test just to see if you have a little bit more feeling in those shoulders and neck area, okay? Perfect, okay. And we're just going to just gently right here. You can feel that? You can feel that more than you did before. Good, excellent. Okay, and now we're just going to go down to your shoulder area here. You can feel that? Good. Good. And how about just up here on your forehead? You can feel that as well? Excellent. And you can feel that just on the top of your eye there as well? Okay, good, good. And what about just on the chin here? You do? Okay. And again on the shoulder? Good, good. And just one more time on this other side. You felt that perfectly. That is great. I'm so glad to hear. So it looks like we don't have to go to the next steps, which is very good, I must say. But I'm glad that we can solve this issue for you today. Is there anything else I can help you with? No problem at all. It was my pleasure. Well, I hope you have a wonderful day. Please stay safe out there, and I will see you next time. Take care. Hello there. How are you feeling today? Yeah, a bit of a headache and migraine I see in your file. Okay. That's why I put up this background today, so that you won't have to worry about certain colors hurting your eyes or anything, okay? So I want to make sure that you are comfortable and we can get you through this appointment, okay? Excellent. Now, just to start, we have modified the lighting just a little bit, just to be a little bit more softer on the eyes, okay? Is that okay for you? Okay, good. Does it feel like it's a little less painful in this environment rather than fluorescent lighting? Okay. Okay, well, we can stay right in here and we will try to get to the root of this problem, okay? So you're in for a cranial nerve exam today? That was what the original appointment was for. Okay. Well, I think today we'll do a bit of a combination. We'll do some cranial nerves, some more of the relaxing stuff that I know won't affect your eyes or make the migraine or headache even stronger, okay? Perfect, okay. Well, first I just gotta get my bag here and just take out a few of the things that I'll be needing, okay? You are the first appointment of the day. Okay, perfect. Thank you so much. put these right here so they don't clang or make any loud noises for you, okay? Now that I've got everything from inside the bag done, we can jump right into the appointment, okay? Are you still comfortable? Okay, good, excellent. Just put my bag just right over here. And I think just the first thing I'm going to do is just check for your breathing. Okay, check with my stethoscope here, and just to see how your lungs are doing, as well as listening to your heartbeat, okay? Excellent. You let me know if you are feeling any pain because of something that is in the office, okay, or one of the tests we're doing, okay? And we will stop it immediately and find an alternative. Okay, first off, we're just going to do this really quickly here. And if you'll just take in a deep breath for me and then just let it out slowly. Okay? Perfect. And just on the other side here. And just take a deep breath in for me, and then just let it out slowly. Perfect. So everything seems to sound fine with your breathing there, as well as your heartbeat, okay? So we will just move on to the next one, okay? Are you feeling comfortable? Good, good. I will continue to ask just to make sure everything is perfect for you in this appointment, okay? Fantastic. Just put those down there because I will no longer be needing them. And the first thing I think will really help with this is we're going to jump in to some sprays, okay? And for this, we'll be using a couple different scents from the spray bottle here, okay? And now, if just for a moment you will relax and listen to the water as it swishes around in the spray bottle here. And just allow yourself to get lost in the swirling water. The swirling water right in front of you, inside the bottle here. Just allow it to relax you, and know that the scents you'll be smelling soon will be pleasant as well as relaxing. And I think we will get started with the first spray here, okay? Okay, are you ready? I'm going to spray this scent in front of you, and I'd like you to tell me what scent it is, okay? There are 5 scents in all in this one bottle, each compartmentalized and ready for this. Are you? Perfect. Let's get started here. And get ready to sniff. And just take a big, deep breath. Inhale. Good, and release. Now, what does that smell like to you? Yes, correct. Peppermint. Good job. very relaxing and stimulating to the mind, okay? So to get to the next compartment in the bottle here, we have to place the lid specifically. And we have to turn it slowly. There we are, and now we have the next scent ready to go. Now with the same specifics as the last one, get lost in the waves here, in the sounds of the water, and just allow it to bring you to a new state of relaxation, okay? Relaxing the mind and giving away to the tension in your head, okay? And are you ready for the next spray? Perfect, here we go. And take a deep inhale. And release. And what does that scent smell like? Lavender, yes, you are correct. A very relaxing scent that many use in their homes for their own relaxation. Allow the lavender to wash all over you. Now we will be moving on to the next scent. Gotta put the lid on just right here, okay? And we turn, and there we are. We have the third scent. And just as before, get lost in the scents waves, okay? Watch that waving scent there. Though it may look like water, it is infused with the many scents you've been smelling. Just allow it to wash over you. Okay, and are you ready for the third? Perfect, and here we go. And inhale and exhale. Very good. And can you tell me what that scent is? Yes, soothing like vanilla. Good, good. That is correct. This one also aids in relaxation, but also relaxes the mind as it enters in through your nostril passages and head towards the receptors of your brain. We are going to move on to the fourth now. We are going to change this up here. And turn. There we go. And once more, get lost in the water, looking liquid splashing around in the spray bottle. Let the waves take you over and give you pure relaxation. And we are ready for the fourth scent. Here we go. Oh, I might have gotten a little on your eye there. Okay, and inhale. And exhale. Now can you tell me what scent that was? Yes, that is right, the ylang ylang tree. It is very blossomy, very cherry blossom smells that go as well to the receptors and relax the entire body as well as the brain. Very good job. You are really good guessing. So now we are on to the final scent here, okay? And all these scents aren't bugging you or making the headache worse. They are helping. Good. I'm so glad to hear that. That's fantastic. And we will just exchange the last scent here. And we turn, and the last scent is here and ready to be sprayed. Just allow for the last time. Let the waves wash over you and the sounds wash over you. Loosening up and relaxing the tension in the brain even more. Okay. Here is the last spray. Are you ready? Okay, here we go. And inhale and exhale. And what was that final scent? Green tea. Yes, you are correct. The last one was certainly green tea. It was very subtle, but you were still able to pick up on it. And this also contributes to relaxation, which obviously is the theme of today's appointment. So now we will put this away here, and we will move on to the next step in our cranial nerve appointment, okay? Your head is doing okay still. So what we're going to be doing is I'm going to be trying to move your head in different places, okay? And I would like you to prevent me from being able to move your head, okay? We're going to be moving left and right, up and down, okay? That's not going to be too painful or anything for you? Okay, good. So that means we can basically do a full scope of cranial nerve today, just minusing any light exposure or any eye tests, because we don't want to strain your eyes today. So it looks like this appointment will be very successful. So now, before we get to that, I'm just going to tap on different areas of your head, okay? And I'd like you to tell me if you can feel that, and tell me which area I'm tapping into, okay? Perfect, okay. Good, and what about here? Good, and what about here? And what about here? Okay, good. And what about right here? Okay, good. And here? Perfect. And right here? That's all in the right places. Perfect. Okay. Well, it sounds like we might be getting a storm outside, so please don't mind any loud sounds that you hear, okay? So now, like I explained before, we're going to move on to trying to move the head in certain ways, okay? And now I'm going to attempt to move, basically be pushing on your jaw back and forth to the left and right, okay? Okay, perfect. And we're just going to try and resist it all you can. Perfect. And what about on this side? Okay, good. And we're going to try once again on this side. Good, good. And this side. Excellent. Okay. And now we're just going to try pulling it down here. Very good, very good. And we're going to try pushing it up as well. And you're stopping me from doing that too. Okay, good. And now I'm just going to try and twist here. You're preventing me. Okay, good. And we're going to try twisting here on this side as well. And nothing moves there. I'm just going to try one more time. That side. This side, okay? This way. This way. And twist. No, perfect. And twist. Okay, good. Everything looks great with that. It seems like none of this has anything to do with any of the sensations, touch sensations on your upper body, okay? And as well as your head. So we'll move on to the next cranial nerve and see if we can help you a little bit more. And I think the next part of that, because we've checked over that cranial nerve of touch and you'll be able to handle it, I figure a tension massage for the head as well as the upper neck should be a key into helping it a little bit more for you, okay? Are you okay with that if I were to massage your upper neck as well as your head and scalp? Okay, perfect. This should help reduce any swellings or tensions or pains that you have as well, okay? So I'm hoping this will be a big factor for that, okay? And we're just going to start right here. I'm going to start just the low bottom. That feels good. The pressure's not too hard or anything. Okay, good. Feel free to sit back and relax. of the last things we're going to do is use our little medical medicine droplets to help alleviate the last bit of pain and pressure that you're feeling within your head, okay? That last bit of pain and pressure, we're going to get rid of it for you today. Going through all those other tests with the cranial nerve shows that we are allowed to do this, and you are a perfect fit for this medicine, okay? So it will consist of 3 different medical droplets, okay? Each will be placed on your tongue, and by the end of the session, essentially, it should feel much, much better, okay? It should feel much better. Okay. Are you ready to get rid of this headache? Okay, good. I thought that might be your answer, okay? I would have the exact same answer. Okay, so this one just needs to be stirred up just a little bit, okay? Just needs to be stirred up here. Just gonna make sure that everything gets in the right flavor areas, okay? Okay, so here is the first one here. Okay, here is the first one here. If you will just stick out your tongue here. Perfect. And allow it to just drop on your tongue 3 times. Perfect. And do you find that this one had a particular taste at all? Do you find that this one had a taste at all? Vaguely, okay. Good, we're trying to get the formula to the point where there is no taste at all. So thank you for your feedback. Now I'm just going to grab the next one here, okay? I'm just going to grab that next one. And do the same thing with this one. This one needs to be stirred up rather nicely, okay? So please just bear with me as I stir this. There we go. Okay, I think this one is stirred just enough here so we can there we go. So now the same thing this will be 3 drops of a type of relaxation medicine for migraines, okay, as well as headaches. So if you'll just stick out your tongue, and again, it will be the 3 drops, okay? Are you ready? Okay, good. Here we go. Are you ready for the first drop? Now with this one, we let it sit for us just a second. And then here comes the second. Perfect, okay. And the final drop, okay. Good. There we go. Perfect. That went splendidly. Now, sometimes, if that part of this procedure doesn't go well, then it is a complete waste and does not help with headaches and migraines. And that's why we need to test ahead of time to make sure that you are a proper candidate for this, which I am so happy that you are. And I'm just going to get out the final dropper, okay? And the very similar to the last one, okay? So we are going to do 3 drops like the others. And like the last one, we are going to drop and then wait, okay? So drop and then wait. Drop, wait, drop, wait. And we'll be doing the 3 as per usual, as I've said. Are you ready for the final medicine trial? Okay, perfect. Stick out your tongue here. And just let this drop. Okay, and then we are going to wait. I'm just going to wait a second here. Let that sink in, let that sink in. Just let that sink in. Okay, good, okay, good. And here is the second drop. Okay, good, perfect. That is the second drop. Let that sink in, let that sink in, let that sink in, let that sink in. And the final and third drop. Are you ready? Here we go. Perfect. And we just let that sink in, sink in, sink in. Okay, perfect. And now, did you taste any of them? Only the first one you were able to taste, okay? So I'll make sure to keep that in mind for when I'm doing the recipe, when I'm tweaking it, okay? Now, do you feel it working through your head at all and helping with your headache and migraine? Okay, good, good. I'm glad to hear. You can feel it subsiding. You can feel it subsiding and going down even more. Fantastic. That is exactly what we were looking for in this appointment, and I'm so happy we did. My pleasure. Please come back anytime you have any other appointments, cranial nerve exams. Please come to your friendly neighborhood Dr. Relaxa. Okay, perfect. Well, I will just take my leave and I will let you gather your stuff so you can as well. Okay, perfect. Take care, and I hope to see you again very soon. Bye now.